to the discussion, How to Be a Hero, the Jewish Response to COVID-19. We're very excited to have him here. Rabbi Dr. Aldrich is going to give his presentation, and then at the end there'll be time for question and answers. So right now everyone's going to be muted. Please stay muted the entire time he's speaking, and then once we open it up for questions, you can unmute yourself. If you have anything pressing, there's a chat window. You're welcome to announce where you're from, where you're watching from, or if you have a question you want to kind of come back and remember, you can go into the Zoom chat if you're on Zoom. We have people both on Zoom and on a phone conference, so hopefully we'll be able to have people answer both those questions. So now let's welcome Dr. Aldrich. Thank you.
Thank you very much. Thank you so much to Rebbetzin Berkesin and to Ma'ayan. I'm honored to be here tonight. And thanks to my mom and dad. I think you're online as well. It's a tremendous honor right now. This is a very tough time for many of us, especially those of us whose children will be home probably the next month and a half to 2 months. A lot of thoughts are going on right now. So to begin with, I'm not that kind of doctor. My doctor is in philosophy, not a medical doctor. As I think Dr. Form is here tonight, he's the medical doctor. So the questions and approaches I take are not about medicine per se, but rather about the social science of disasters and networks. And my talk tonight will be both on the Jewish aspect, what are we facing right now, how should we respond, but also on the social science approach, what do we know about these kinds of situations, what should we be thinking about? Just in case you've got questions I don't have time for, my email address is there at the bottom of this very first slide. Hopefully you can see that. Thumbs up if you can see the first slide with my name. Some can speak, yes, maybe you can see the first slide, I hope. Great. So my email address is there just in case you have questions. So let's just begin with the first question, which is the following one. What are we facing right now? And there we go. What are we facing right now? So there's a well-known Mishnah in Masechet Tainis that asks the following question. Actually, it's really from Rabbi Akiva. He asks the following question, is a dever, what is a dever? What is a plague? And he describes not the plague itself, but the consequences. Rabbi Akiva says the following, he says, dever is an ir motzia chamesh me'os raglai, a city that can supply the food for 500 standard soldiers, v'yatsu mimenu shlosha mesim, shlosha yamim zeh acher zeh, and over a three-day period, there's at least one death over those days. So some people say 3 or some people say 9. In that case, he says, Harei zeh dever. That is a plague. So most Meforshim understand the following. That means not among the women and children or the elderly, not among those individuals who we say are immunocompromised or vulnerable, but among the strongest individuals. If we have roughly 3 to 9 people die in a 3-day period, the Chachamim call that a dever. By the way, why does it matter? It's a halachic status. If in fact we, the Jewish nation, are in this moment of a dever, there are things that we have to do, including, for example, blowing the trumpets, hatzotzros, and also fasting. I've put down at the bottom of the slide what exactly that means. What number is that? And if you want to know exactly where we are then empirically, I brought in data both from China and also from Korea. So among the normal population around the world, that is to say the non-elderly, non-immunocompromised population, we have not quite reached that stage that the Chachamim call in the Mishnah a dever, a plague. The bad news, of course, though, is that for those individuals who are elderly, for individuals who are immunocompromised, we have seen consistently high death rates from this virus, roughly 14 to 15% among the most elderly and between 1 and 8% among those between 50 to 80 years old. So this is not the flu, whatever you've heard from friends, from commentators on talking head shows. This is not just a normal moment in history, and we'll talk about more about how we know that to be true. But what we're facing right now, again, is not just a normal day, not a normal winter flu. So let's talk about what we're supposed to be doing in terms of listening to doctors and listening to individuals around us. Let's talk about that a little bit. So I've brought here just a few sources, some of my favorite speakers. First of all, we know already in Devarim, there's this concept of guarding ourselves and choosing life, which means there are some religions, unfortunately, who when a disease happens, they argue if the disease happens, this is the will of God. And therefore, if we get sick and if we die, there's nothing that we should be doing. There's nothing, no action to take. Let it be. Judaism says the opposite. Judaism says it's our job, in fact, to take action when we get sick. There's a very well-known brisa in Masechah Sanhedrin. It goes to the things you have to have. I'm sorry to say that Beacon Kosher is not among them, but it says you need to have a doctor in a city, or else a rabbi, someone who's knowledgeable, cannot live in that community. That's a pretty powerful statement to make. And then the Shulchan Aruch actually rules, not only are doctors given the power to heal, which is one argument, right? Again, you could argue, well, if God made us sick, then God will heal us. So no, the Chachamim rule as a halacha, and again, Shulchan Aruch is what we do. We rule the following. If there is someone who is sick, the doctor's job is to heal. The next thing we say, it's not only the job, it's a mitzvah, meaning it's a commandment. Failing to do so, failing to take care of someone who is sick, in fact, is called shofech dam, meaning if you're a doctor, if you're someone who has knowledge of how to stop, let's say, a dever or some kind of disease, and you don't take action, you're not just being frum or pious, you're actually missing the boat. Chachamim tell us, the rabbis tell us, it's our job to fix things. So again, science, medicine play a role in what we have as Jews. This is a very old perspective that I'm talking about here. Okay. Now, let's talk a little bit about what is going on right now. So we have a number of different activities taking place in our society and around the world. As you know, if your children are home and excited about being home from Tuesday onward in Boston, schools, the Museum of Science, the Children's Museum, most theaters, pretty much everything, certainly in Boston, in New York, in Seattle, big areas like this. It's been the same now in Tokyo and also in Wuhan, China, and Singapore. Those are all closed. And the idea, of course, is to limit the ability of the virus to spread by making us more physically distant from each other. We also right now in North America, we are testing, and not enough, but we're testing some of those who show clear symptoms of the coronavirus. We are disinfecting mass transit. We've just begun right now to close some borders, and we have this broader idea of physical distancing. So again, our society as a whole is trying to take on this virus using the tools we have available. Now, why are we doing this? Why are we bothering to do things like physical distancing? It's a very simple idea. If we let the virus take its course as it is right now, it is highly likely we will see so many cases that the ability of our healthcare system, which is fragmented right now, between both rural and urban, wealthy and poor, private and public insurance, Medicaid, and so forth, to the degree that it's very likely if we had a massive number of individuals showing up tomorrow at ICUs around the country, whether it's in Boston or elsewhere, they would be overwhelmed. We would lack sufficient respirators, personnel as well. And of course, beyond that, we would probably be infecting a number of those individuals on the front lines of the fight. That is to say, the RNs, the nurses, the staff, they would get sick to the degree they wouldn't come into work. We'd have a degradation of the quality of care. More individuals who would normally be having elective surgery right now, whether on hips, let's say, or a dialysis treatment would be pushed off. And then not only would we have more cases of death from the coronavirus, but this large lump that you see on the left side of the screen, this uncontrolled transmission, would probably cause more deaths and a spiral in those people not exposed as well. The idea right now is to push down, to suppress the overall spread of cases, to reduce the transmission across us over time. Now, the obvious question is, does this work? Right? All the effort we're feeling right now, having our kids home with us, not being able to go to our NBA basketball games or whatever else drives us, does that work? The cool thing about social science is we have very good evidence from past, let's call them epidemics and pandemics. This is from the 1918 flu, that, as you might know, killed more individuals at that time than other wars have proportionately. This was a major cross-country flu, a serious problem, and we have data from two different cities. On the left is St. Louis, Missouri. On the right is Pittsburgh. They weren't exactly the same size. They're pretty close at the time. And you notice they had very different responses. In St. Louis, they immediately began what we're calling physical distancing, closing schools, theaters, and sporting events. In contrast, in Pittsburgh, those were staggered. First, they tried banning public events, then they tried banning schools. And you see over the same period of time, between September 1918 and January 1919, St. Louis suppressed that curve. That is to say, pushed out those cases over a period of time. Pittsburgh did not. So at least based on historical evidence, we're quite confident that this approach we're taking right now, of causing us short-term uncomfortableness with our children at home, with no sporting games, with no theater tickets and so forth, no Boston Marathon, will have a positive and measurable impact on our society and reduce not the total number necessarily of deaths, hopefully that will as well, but at least the spread of them over time. We also see cumulatively now across countries also very different responses. So here I've brought together a graphic from the Financial Times, which has 7 different nations also fighting the coronavirus, ranging from countries like Italy to Singapore. And I say range because those countries have dealt with this in very different ways. The moment that mainland China, back in December, began to talk about the Wuhan virus as a potential contagion, Singapore by early January shut down borders, closed schools, initiated all kinds of testing, and traced individuals where they were going. You also see right now the different curves. The US, our country where I'm speaking from right now, we are very, very early in this phase. We're about a month or so, let's say, behind Italy. That means we have not yet really seen the major impact of coronavirus on any of our society's institutions, whether it's hospitals, healthcare costs, financial bankruptcies, or broader social disruption. But the good news is countries like Singapore and Hong Kong did also, like St. Louis, bring down that curve. Now, I want to take what we've been talking about and talk about Judaism again. What are we supposed to be doing as Jews? And then I'll talk about a little bit what social science says as well. Our job, especially during a moment like this, is the concept from Shavuos of Kol Yisrael Arevim Zer Lezeh, that we are responsible for each other. This, of course, includes normal places, like if you've been giving tzedakah, you should continue it up. If you have people, for example, who are making mistakes, tochacha is still here. But also right now, if there is someone whom you can visit, we'll talk about that in a second, or you can at least make feel better, and Bikur Cholim could be both. It could be a visit in person, it could be a phone call or an email. If you can do those things, that is our job. It is to say, nothing about Judaism says right now we're supposed to stop the emotional and social capital support that we would normally show, despite the need to physically distance. So it's important, I'm calling this, by the way, physical distancing and not social distancing. Unfortunately, the media has been using the term social distancing. That's the wrong term to be using. Because the social ties that we have to each other, the feelings of connection, support, and integration, those feelings and those resources are critical. And this is where we're going to go into some of my own research that I've been doing since 2005. In situations like this one of the COVID-19, or the heat wave in Chicago in 1995, or Japan's triple disasters in 2011, it's not just being elderly, frail, or immunocompromised that causes deaths. Those are factors. But what really tends to kill people in a shock is the interaction between social isolation, a lack of ties and trust, a lack of support, and those factors of vulnerability. Most people have been talking about vulnerability as the biggest danger that we face right now. That is to say, being elderly, being immunocompromised. Those are part of the factor. That factor of vulnerability times the lack of social connections, that is what is a real danger for people. My work since 2005 around the world has focused on the concept that during a shock, whether it's a slow onset shock like a drought or a pandemic, or a rapid onset one like a tsunami or a volcano, what helps individuals survive and thrive in those moments does not come from wealth or insurance, assistance from the government. It comes from our ability to connect to other people. And there are 3 main types of connections that we have: bonding, bridging, and linking social ties. Bonding social ties connect people who are quite similar, the same language group, ethnicity, race, and background. Bridging ties, often through institutions like a synagogue, a club, a sporting event, or workplace, those connect us to people who are different than we are, at the same level of power. Linking ties are vertical connections to individuals who have decision-making ability and authority in our power. It might be, for example, if you know Mayor Walsh here in Boston, or you've got a friend who runs CJP, or maybe you're lucky enough to know someone in the White House these days. So those horizontal and vertical connections, those are the resources that interact with vulnerability during a shock. and either help us get through it and do well, or put us in a bad place. The broader challenge that we face is many of the challenges during COVID-19 and during other shocks require collective action. I'll give you some simple examples. Imagine that you're going to your restroom this afternoon and you're locked in your home safely and you recognize you have no toilet paper. You're out completely. Now, for most of us, hopefully we have neighbors nearby that we can ask for help. Relatively minor problem since COVID doesn't cause diarrhea, but okay. In those situations, if we have connections nearby, we send a child to our neighbors, they knock on Rabbi Beer's door, we ask for a toilet paper roll, and we're done. If we don't know our neighbors, if we feel uncomfortable knocking on doors, if we're new to the neighborhood, we don't speak the language, we don't have ties nearby, that lack of toilet paper quickly becomes a problem. And of course, there are much deeper problems. Imagine, for example, that I really don't feel well, or I don't feel well to the point that I'm trapped now in my apartment and I can't get out of my chair or my bed. I live by myself, like one of our neighbors does. If I don't have the ability to connect to other people and organize collectively, if I lack those social ties, what is an annoyance could quickly become, unfortunately, a hospital trip. I have, for example, a relative who once fell in her apartment and was on the floor for 7 hours. 7 hours before someone found her. Those kind of moments can quickly turn again from a minor inconvenience to something that's much more serious. So these social ties provide us the ability to overcome a challenge, whether it's being on the floor or lacking resources, because they give us informal insurance. Hopefully we all have private insurance, whether it's health or medical or car. Informal insurance cannot be purchased with money. It only comes from investing time and trust in people who live nearby. These are hyper-local resources. Do I know my neighborhood? Do I know my neighbors? Do I have people nearby who, if there's a fire, if there's a heart attack, if I don't feel well and I can't get to the phone, who will know that I'm in trouble? I want to give you some examples how these kind of ties have helped in a number of disasters in the past, and then come back to the COVID-19 in a few minutes. My team and I measured, before 3 major hurricanes, what people did as the authorities told them to evacuate. This map you're seeing right now, those red dots on the first image on the left, those are all the individuals who are holding cell phones on the 4th of September 2017 in a very dangerous area in Miami, which would become the center of the Hurricane Irma a few days later. Those red dots indicate individuals who did not leave. Look now on the 6th of September. Those blue dots indicate individuals who fled from Miami to other areas and became safe. By the 8th of September, when the hurricane actually arrived, roughly 30% of Miami had evacuated, but the rest had stayed put. What helped people leave a dangerous area and listen to the authorities? So my team used data on social networks to track what factors made individuals listen to those warnings. The most powerful predictor of listening to a warning came from having a broader and more diverse network. Knowing more people beyond Aunt Jean or your grandma, having connections beyond your family, having people nearby and further away, those kind of connections gave you information and motivation to take seriously these warnings. To talk more personally, in my own family, there are individuals who have been warned for some time now that this virus is not a laughing matter. And it took a phone call from someone who they respected to get them to change their behavior. That wasn't me, by the way. So these kind of connections, these ties, they make a big difference even as the shock is coming. Our lab also studied the survival during some quick onset disasters, ones where there really was not big warning. This image shows us the percentage of individuals killed in cities along the Japanese coast in 2011. In some communities, nobody died. That's the really big, tall graph. But to the right of it, in some communities, 1/10 of the people died. Between 0 and 1/10 of the population dying, we have some cities with 1%, 2%, 3%, all the way up to 10%. What happened that some communities on the coast faced no casualties and others were decimated by this fast onset disaster? So we tested a number of different theories, including physical infrastructure, connections in the area, the power of the wave that was coming, demographics and vulnerability, but also social ties. Of these factors that individuals possessed along the coast in Japan, the best predictor of surviving that massive 6-story tsunami came from being in a community where individuals were connected to each other. Where there was trust, reciprocity, interaction, people worked collectively to save lives. That form of informal insurance taking root. As the tsunami came in, elderly people were being picked up literally and carried out of vulnerable areas. We also studied the survival and recovery processes for those coastal communities to understand why did some communities take so long to rebuild, their economies to get back online, children to get back into schools, and others did a pretty good job. Here in this process of recovery, we moved beyond the horizontal ties to vertical ties. We needed to have ties from the community to decision makers. They could tell them what resources were needed, what areas needed strengthening, and what areas weren't necessary. And these are images that we took in cities in Japan like Ishinomaki. On the left there, that's grayed out. That was 2 weeks after the tsunami. On the right was 2 years afterwards. And this is the area of Tagajo and Sendai, 2 weeks, 2 years, and about 3 years. Why that white van is there, I can't tell you. But in all these communities, recovery came because of connections to powerful politicians, vertical ties to individuals who had decision-making authority. We also studied mental health during one of the worst evacuation periods of a radioactive disaster, the Fukushima disaster, where there are a number of different types of responses that people had. Some people's mental health did fine. Others dipped initially and came back. Other people, unfortunately, faced anxiety, sleeplessness, depression, and PTSD for the last 9 years since those shocks. What factors among those communities have given individuals the ability to find themselves more mentally stable in these communities? Over and over again, it was the same answer. Individuals who had stronger social ties, stronger networks, more neighbors, those individuals handled the shocks of having to evacuate and go through a tremendously stressful period far better than similar neighbors of the same age, same wealth, and same education who lacked those social ties. So I've tried to argue so far, based both on Judaism's concepts of what matters, but also on social science evidence, what we should be doing. And what we need to have at this moment are strong social connections. So I'll begin by saying the 4 behaviors that we should not be doing. Number 1 is we shouldn't be panicking. That means, for example, we shouldn't be telling people that we're doomed. We shouldn't be taking on irrational behaviors. We shouldn't be taking medicines that turn us blue. We shouldn't be relying on the lies and tricks and promises of people who aren't doctors. We should be listening to the authorities, staying calm, and being connected. The second thing we shouldn't be doing is hoarding, for all kinds of reasons. First of all, Judaism says life's not a zero-sum game. That means you grabbing all the toilet paper from the store isn't necessary, or me taking home all the beans and rice. Those kind of behaviors, God tells us, aren't necessary in a moment like this. It's also really bad for broader society, right? When we have to engage in behaviors that aren't necessary. There's nothing wrong with the food distribution systems. Walmart, Costco, Piggly Wiggly, they're all doing fine. Nothing is wrong with distribution systems. Logistical chains are still running right now. You can still get food, you can still get those things. The third thing not to do is to take the concept of physical distancing so far that you stop interacting with, finding faith and comfort in, and friendships in the community and God. This should not be a moment of self-isolation, meaning that you believe you're alone. And finally, you shouldn't frame this as a political event on either side, claiming that if only they had done this or President X would do better at that. That's not going to help right now. Those issues won't get us there. What should we be doing then? How are we moving along? So this image one of my friends sent me from a Costco. I wish I could tell you these people were cooperating to bring down the last bag of rice, but they weren't. People were literally struggling in a Costco, fighting over the last bag of rice. And we also see, this is coming from Iran, our brothers and sisters over there. That's a satellite image of them digging 2 football-sized fields graves right now, because the city and the communities there weren't practicing what we're calling physical distancing properly. And now they have a number of people, unfortunately, who need to go to rest in those communities. So that's what we're not going to do, hopefully, here in North America. Here's what we should be doing. First of all, stay at home. If you don't need to go out, if you don't need food or medicine, if you don't need to deliver to something to someone else who needs it, then stay at home. Don't go to bars, don't go to restaurants, don't go to your wherever else you're going to go. Stay at home. Next, again, don't hoard. Share what you have. Reach out to people in our community. Just because we can't hold hands and kiss doesn't mean we can't share information and emotions. We should be using phones, internets, we can drop off stuff at people's doors. There are all kinds of things that we can do that will limit the spread of the virus, but keep those social connections going. If you know of parents with many kids at home, and you've been confirmed as someone who's healthy, or those are families that you're hanging out with anyway, and you have either the funds to get a babysitter or the ability to help them out, think what we can do. How do we help the family with 8 kids stuck in a 2-bedroom apartment for the next 2 months? How do we help the families who are buying Passover food right now, whose budgets are already strained? Next, follow the doctor's orders. The best weapon right now against this virus is soap. It destroys the lipid layer of these viruses, a very, very effective thing. We also still have a very powerful weapon of spiritual warfare. We have been granted from our ancestors the ability to do things like learn Torah, daven and say Tehillim. And by the way, any zechus tonight generated by our learning in Torah should be going to those individuals in our community elsewhere who are sick. And finally, if you're really bored, buy my books. All my books talk about this concept of social ties and social capital. Our job right now should be to connect to each other and make sure that we build a society that will come through this intact, whole, and together. Thank you very much. I'm happy to take questions.
Okay, hang on. So right now everyone's muted. I'm gonna let people unmute themselves to ask a question, but once you ask your question, please mute yourself again so that we can avoid as much auditory feedback as possible. So I'm going to grant that access. So if someone has a question, they can unmute themselves and ask for Rabbi Dr. Aldrich. On the bottom left corner of your screen, you can unmute yourself if anyone has.
Hello?
Hi.
You said it by halakha, definition of halakha, it didn't meet the definition of a plague. But can we, since we believe in science, extrapolate to declare it a plague?
That's a great question. So, here I would say the following. We, halakhically speaking, have to rely on the Masorah to go to the level of things like blowing chatzot tzros and calling a public fast. If, in fact, the Chachamim argue that what we're in right now qualifies as a dever, there are halakhic responsibilities on me and on us as a community. For example, when David HaMelech and others did hit a dever, they had to go ahead, blow the trumpets, fast, say Tehillim. If, for example, when Eretz Yisrael lacks water for a period of time, and the Chachamim define when that period of time is, during that period of time, we as Jews, again, have to fast, blow the trumpets, and do Tehillim. So right now, yes, of course, it is a pandemic by science definition. We can be saying Tehillim individually. I'm just saying in terms of the halakhic responsibilities that we would have if it were a dever, the Chachamim have not yet taken us there.
Any other questions? Give one more second.
I have a question. This is Stephen. What would you suggest in terms of the social resilience? How would you show that compassion and connection to others?
Yeah, so the question was, how do we show social connection and resilience at a time like this? For my brother. So it's a great question. So a lot of things we can do. I've seen a number of people who are going shopping saying out loud, I'm going to Costco, who needs the following things? Or give me a list of things that you need. And they come back from Costco with that van full of toilet paper or medicine or rehydration salts or toys or board games for kids, whatever it's going to be. So if we're going to go out, again, because we have to go out, at that moment of going out, we have the ability to help others in that what could be a very selfish act of shopping for me can become a communal act of shopping for others. If I know, for example, there's someone who is either sick with this or someone's in the hospital with something else, and we're able to visit them, and again, right now, many people cannot be visited, whether it's in an old age home or hospitals, at least call them, send them a card, send them a text or an email, send them a gift that they can use. We can show individuals who right now are feeling alone, left out, and scared that we're thinking about them, right? We can also, again, for example, have a gemach, a sharing situation, where we'd share things like toilet paper or board games, if we have those to share. And more broadly, I know my wife's part of a thing right now where she is saying Tehillim, she's saying Psalms for individuals who are sick. So we can take our efforts and our time and focus them outward rather than being worried, am I going to be okay? What's going to happen to my family? I found oftentimes focusing on others takes away some of that concern and gets me thinking about a broader perspective.
Hi, this is Barbara. I was wondering if you had any advice for the schools that are now going to the distant learning models in terms of how children and students can use this almost as an opportunity, maybe to learn more, to help each other, and to show that we're still just as least at least we are as connected as we've ever been as a Jewish community.
Yeah, that's a great question. The question was, now that schools are going online and students won't see each other face to face so much, how do we have our students, our children, feel connected and feel engaged? I think it'd be a great project, for example, if there are individuals who are in hospitals, if there are individuals who are sick or elderly, have the children brainstorm as one of their chesed projects or a project during the day. How can we help individuals whom we can't see? What can we do to make them feel loved? I know, for example, that when Israeli soldiers, lone soldiers, are in Israel, oftentimes a school will adopt them. They'll send them food packages. They'll send them notes to make sure that they feel that even though their family isn't there in Israel with them, they have someone looking out for them. So it'd be great if students, for example, could adopt someone who is sick, or think about a nursing home, or maybe one area nearby. I know Boston has a number of nursing homes for the elderly. Maybe adopt them, do what they can. Again, if they can't go there themselves, send gifts, send notes, send toys. They can record themselves talking. They could use, they could play a song if they have musical talents. I can think of all kinds of ways they could draw a picture if they have artistic talents, to use that ability to help other people. I think even just reaching out, making sure that children don't think that this, quote, unfortunate phrase of social distancing means they can't call their friend who's just a few doors over. Actually, my wife was kidding the other day. Maybe she said take turns walking up and down the street, yelling out, "Hey, how's it going? Hi, Daniel here on the street. What's going on?" And just walking down the street one at a time. Again, those moments. And because distancing also means, for example, if your child, and they should be taking walks, they should be getting out of the house by themselves in a safe way, take a walk around the reservoir, take a walk around the area, keep that social distance, but say hi, wave at people as they go by, yell at them. Again, I think part of this moment right now, the reason I think I feel anxious is because it can really feel like we're alone right now, or stuck with our family, which is a bad thing to say, but somehow we feel trapped with cabin fever. Recognizing that we're all going through this together, recognizing that we have those connections still, I think that will help it get by more easily.
Thank you.
Hi.
I have a,
Oh, is there someone else talking, or is it just me? Okay. Hi, I'm Brenna. I'm actually from Philadelphia. Hi. I was listening to what you said about like games and everything else. And we also know, which I think is a great idea, but I'm worried about people who have the virus and they don't have symptoms. And so I'm not sure how safe that is. And so it's like, I know I'm one of those people who's a little bit more immunocompromised. So I know I wouldn't be helping people in that way, but like, just even for people who are not, like, we don't know, and it's going to be a while before more people have access to find out whether they have the virus or not. So I'm not sure how safe even that is. So I'm just curious about your thoughts about that.
Yeah, actually, I was telling some of my friends that there are all kinds of games you can play over the internet. Words with Friends, Scrabble. You can play Life online, and Sorry, checkers and chess. My son beat me at chess the other night. It was very embarrassing. So there are all kinds of things you can do that wouldn't put anyone at risk, that would still allow you to play. In the olden days, you could play chess over the phone, right? You could call out the piece where you are, Queen's Knight to Q4. So I think there are things we could still do to have that idea of games, ideas of connection, even if we can't be together. I was also wondering too, could classrooms, so to speak, gather using a Zoom or a LinkedIn and have a game together, or maybe a classroom on the East Coast can talk to one in Seattle. What are you doing? How are things going for you? Or how, New York and Boston, what do you see going on around you? Or I just came back from Israel, how's it going? I think there are a lot of things that we could do that would avoid the possibility of spreading the virus, but still, again, give us that feeling of interacting, that my move, so to speak, is reflected in your move, and your move is reflected in mine. I think part of that was what's going on.
Thank you.
So you said that there is increased survival for communities with connections to people in power. What is our obligation to acknowledge, while we are advocating for ourselves, maybe someone else's community where they don't have as much direct connection, but there are vulnerable people?
That's right. The question was about how do we make sure that if we're advocating for our community, we don't forget about other communities that maybe don't have a voice right now, or a mefuzar, as we just read in the Megillah, that are scattered for whatever reason. I think that's a great point. In fact, it should be our conscience and our voice speaking are there individuals in our community who don't have the phone call or time to call Mayor Walsh to report something, whether it's the garbage not being picked up, or there's this problem in the community right now, or I saw this happening. So, we know right now, unfortunately, not everyone uses the tools they have to reach out to decision makers. And part of this should be thinking not what I need and my own immediate community needs, but what do we all need? I mean, in a sense, physical distancing is being altruistic. Me staying home, you staying home, all of us staying home, that is the beginning process of making sure society as a whole hits that St. Louis flattened curve, right? Rather than the Pittsburgh heightened one. So in a sense, by doing that, I already am reaching out. But again, when I reach out and ask for help, I should be asking for more than just my synagogue or my block. I should be asking, I think there's a problem. Can we get Wi-Fi to communities right now? If there are 6 children in a home, all are on Wi-Fi tomorrow at 2 o'clock, how is it going to be possible to listen to a Rebbe speaking? And I know in our own family, this is going to be a problem. We don't have Wi-Fi bandwidth. It's going to be some very, very slow processes. So just the concept of how do we help the community get its voice across those who have and don't have to the leadership is an important process.
Hi, this is Daniel in Santa Fe. Remember me? Anyway.
Oh yeah.
How are you doing?
Good. How's it going? Thank God.
I'm just wondering if you have any comments you would make for employers. Some businesses have the problem that they're like restaurants that they're at risk of going under, but other businesses are going to continue in this climate and they're going to be fine from a business point of view, but of course then they have to worry about their employees. So for either of those, I wonder if you have any comments.
Yes, a lot of things to think about. One right now is we haven't talked so much about the economic consequences of this plague on individuals, especially in tourism, in hospitality, in the food industry. Here in Boston alone, pretty much every major catering event has been canceled for the next 2 to 3 months, which means millions of dollars of revenue that would have gone to local businesses, local owners, and local residents is now gone. There may be no employment for them, and they may be laying off workers right now. So whatever we can do right now to think about it, do I have a job at my firm? Is there something that someone could do who is unemployed right now? As the Rambam said a very long time ago, right, the highest form of tzedakah is not giving money, handing to a person, it's helping them find a job. So if anyone listening right now does have an availability, a slot, even a part-time job, I can guarantee, especially in those industries of hospitality, tourism, and food, we will be needing a lot more assistance. So yes, first thing would be if you're an employer who has that kind of ability to hire, please do. The next would be flexibility. I know in this community where I live and my colleagues as well, a number of single parents who have really impossible tasks right now. They're being asked to do their job at work, either physically at work or in a teleconference kind of thing, and their children are now at home, and they cannot leave them by themselves, which means if they have to be at work, they're going to lose a paycheck. And if they have to take the child to work, the child's going to be very uncomfortable day for everybody. So in that kind of moment, everything that we can do to show flexibility for people, everything that we can do to show rahmanut, to show that kind of recognition of the challenges that we face, this will not be a 1 week or 2 week thing. I know people have been talking about opening schools after Pesach. Some of the best estimates I've seen have said it may be 2 or 3 months before we can actually lift this physical distancing in a safe moment. That will be a long time, again, for those businesses and workers to have the struggles of either not having a job or having a job and children at home at the same time. So everything we can do as employers and employees to be flexible, to be open, to think of ways to do this creatively. Can you do round robins of families that are already in contact with, so that people are being taken care of by people who already may have spread the virus if they have the virus? Can we think of ways to bring in outsiders who, again, have been tested perhaps to take care of children? What can we do? This is a broader problem. I'm not sure there'll be any one solution for everybody, but this should be a problem that we're talking about as a community. How do we help single parents, people who are in already a job that's suffering? That's a challenge for all of us.
Can I say
Hi.
something? Oh, sorry, go ahead. Oh, wait.
Okay, thanks. This is piggybacking on what you just said. Obviously, there's a lot of factors involved with the virus that we may or may not know, but based upon your expert opinion, whether we succeed or have less success with social distancing and slowing the curve, what's the inside outside kind of sense of timeframes that are real? Because they're saying 4 or 6 weeks to keep us from freaking out, maybe a little bit, but what can we really kind of prepare ourselves for?
Yeah, so I mean, the models that we have right now are coming from places like China. So the question was, how do we prepare ourselves? how much time should we be thinking about this? The models that we have right now are coming out of societies that have already been going through this now for a while. So that would be, for example, China, Korea, and Italy. And those countries have had very different responses at very different moments in their exposure process. And I think the most honest thing that we can say is that it will probably be 2 to 3 months in North America. We began very, very late. In January already, we had evidence that there was an infection in North America. We didn't do anything. We didn't try to slow border controls. I'll tell you just a personal story. I flew back from a country, Japan, during this period. No one in North America asked me where I had been. No one asked me to self-quarantine, which I tried to do. When I flew later on to a different country, they immediately looked at my passport and said, "You've been in Japan? You now meet our health agent. We're taking your temperature every day twice. We're going to call on you to make sure that you're there. I have your cell phone number," and they double-checked. Some countries took this much more seriously early on. Unfortunately, we're very late to the party right now. Starting in mid-March, with the responsibilities, the border crossings that we just saw, those are not the frontline responses I would have wanted to have seen. So to say 2 or 3 months, I think is a reasonable estimate right now. We also know the good thing is, as the temperature rises, these kind of epidemics tend to peter out as well. Even if we didn't do anything, which would be a bad choice, by the way, but even if we did nothing and let nature take its course, so to speak, it would probably peter out by, let's say, July. But again, right now, the best estimates I think we're seeing are coming from China, Italy, and Korea, and it's been 2 to 3 months with a strong response. Don't forget, we don't weld our citizens into their apartments like China has. Israel right now is using GPS signals to track down individuals who are under quarantine, who left quarantine. I don't think we're going there either. So those very extreme responses using the state's coercive power to compel citizens to be in quarantine and to stay there, I doubt America will go that far. I think much more likely we'll see what we're seeing right now, which is a call to quarantine. We'll see, like in New Rochelle in New York, we'll see for the National Guard there as a sign of coercion, but I'm not using that coercive strength, and an attempt to control this through what I would call the bottom-up voluntary response.
So you don't think that this Marshall scenario that some people are starting to worry about, not letting people travel on interstates, et cetera, is likely to occur?
I have a hard time imagining that across North America there'll be consistent enforcement of that. Having spent some time in different places, different states have very different feelings on the ability of the government to constrain individual freedoms and liberties, even under a situation like this. And we see this even in how Italy has responded versus how China has responded at the very personal level. So I think it's very unlikely, for example, they'll be welding us in our things with blockades in every block. I think it'll continue to be a voluntary bottom-up response. The state calling us very strongly to close restaurants, to close schools, to close theaters. The state can compel those businesses to close. Compelling us to stay in our homes, compelling us not to travel, I think that's pretty unlikely.
I had a question about eventually there's going to be sick people as well as not sick people, large quantities of both, most likely. And it seems like to me there's also going to be, people need to be starting to think about how we work and help people that are sick, maybe aren't so sick that they need to be hospitalized, or a parent that's hospitalized and the kids are okay. There's a lot of other things too that people need to start thinking about and planning for in the Jewish communities and as well as elsewhere, because that's also some major infrastructure put together as it's happening and needs to be planned out too, it seems like.
Yes, for sure. And again, China initially quarantined families together. If someone had traveled and was sick, the whole family was quarantined together and they all became sick. That isn't the best model for handling this. What you want to do is early, when you see the symptoms, get the sick person out of the family to a quarantine zone, not the main hospital, which will be overwhelmed by cases. And again, we do not want the ICU and respirators doing triage. We want a camp-like structure, someplace outside, away from the main hospital entrance where people can go and be processed through. First, a simple nose test, or maybe a white blood test to see what's going on. And then if we need to have them quarantined there, do so. But we definitely need to think about in the Jewish community, how will we handle it? If we have, for example, a family of 6 people, 4 children who are well, which is pretty likely, and 2 parents who are sick, which is also unfortunately quite likely, or God forbid, there's a Zaidi nearby and the Zaidi is quite ill and the Bubby's by herself. How will we organize as a community? And again, we should be having these discussions. Do we have funds set aside? In California right now, the local governments are actually, in a sense, buying up local hotels to turn them into quarantine zones. Do we have spaces in the Jewish community, whether it's in Arizona or California or Boston? Can we turn a place? Is there an unused home or an apartment complex that we could turn into a quarantine zone if we had to? Or the opposite, bringing the healthy family members out of the areas that people are sick if they can't get to a hospital and making an area for them. We should be having these discussions at the communal level. What resources do we have to bear? No one family should be responsible for this, whether it's the sick family or the family is living nearby. This should be a question for, so to speak, the tamchui, the community working together collectively. What can we do as a community to help these families that, as you said, we will have, unfortunately, probably in the next month, much more numbers of individuals who are sick, and those sicknesses will mean individuals cannot travel well by themselves. Sorry, just a question that just came up. The question asked, should families stay apart for Pesach if they live in different cities? I'm not going to answer that question directly because it's very challenging. Here's what I would say. If you have a elderly parent, if like my parents are in their late 70s, early 80s, traveling to see them, even if you're asymptomatic, could put them at risk. My advice personally would be not to travel to them. As hard as that is for families that love our parents and our Zaydis and want to have the Masorah and the Pesach Seder with Zaydi and asking all the Shilas, I would say personally, if traveling to family means meeting with an elderly family member who's above their 60s or 70s, that is putting them in a higher risk category of harm than staying by yourself. And I know a number of families right now here in Boston, for example, that had plans to travel and have curtailed them. I think that's admirable, honestly, at this point. Traveling itself, of course, also means even if you're in a car and your car moves from, let's say, Boston to New York or Boston to Pittsburgh or wherever you're going to go, and you can travel, every place you stop to go to the bathroom, every restaurant you stop in to get food, every time you get Essen Fress in Baltimore, or wherever, you, if you are a carrier, are spreading your disease. So again, it's hard to imagine, but we are the people right now who can stop this. Us not traveling even domestically means if I'm sick, even asymptomatic, I'm keeping it here in Boston in my home, rather than taking it to every gas station, every place I stop. I'm sure you all know the story already. Here in Boston, we had one meeting at Biogen at the Marriott Hotel, not too far from where we live. 3 individuals went in with the virus. 76 are confirmed. Now, what does that mean? 76 confirmed means the cases were so bad, hospitals actually tested them for the virus, right? They're not testing every person who walks in. That means from 3 individuals, we have 76 active cases right now. I think people are doing okay in that poll, I believe. I don't think anyone's died yet, thank God. But again, very serious from 3 individuals meeting one meeting place. So if you're asking for my advice would be yes. If you can stay home, I would stay home.
Hello?
Sorry, go ahead.
Why isn't testing the answer? If we know who's ill, why doesn't that stop the epidemic?
So testing would be the answer, and we have some great information on who has been tested and who hasn't by country. Right now, we're like, I think 23rd from the bottom in terms of the number of tests per 1,000 people that we're doing. Bahrain, Korea, the Philippines, countries with more and less money than we have, invested early, not in March, in January, in testing for COVID-19, allowing local labs, whether it's in Cleveland, for example, or Google Alphabet Labs, to begin early this process. We slowed that process down. We did not agree early on. We reached out, unfortunately, to try and lock in German labs to do the work for us. That didn't work well. So unfortunately, our country has made choices, our government has made choices, rather than opening up the testing and encouraging like a SpaceX kind of program, let 1,000 flowers bloom quickly. And unlike other countries that have began distributing the tests quickly, we have not. We do not have enough tests per population right now. We don't have enough tests for most hospitals right now. Those that we do have primarily are in the few areas like Seattle and New York City. So the testing is way behind. That would be the answer. The honest answer would be something like this: test pretty much everybody that we can, even asymptomatic people, and begin sorting us out and get through this process really quickly. But we're not going to do that. I'm telling you right now, because our government does not have the political will to move us through that process. So that's a political decision made at a very high level, how those tests are allowed to be done by local labs like Cleveland or Google, and how they're distributed with money and funds. We are not testing sufficiently right now to do that. I just saw a question this question came from Dana Levine. The question was, are there programs like Neighbors Helping Neighbors? Is there a Google Doc set up? I know there are already meal trains going on in Boston at least, and there's also a WhatsApp group, at least 2 WhatsApp groups I know about, that do share chesed. So Dana, hopefully you can talk to someone on this chat, maybe my wife, who's Yael Aldrich. You can reach her and she can put you on some of the local WhatsApp groups that are trying to set up these both meal trains and broader questions of Do we have extra toilet paper? Do we have extra water or wine or challah or whatever else? This is the moment to do that. There we go. There's Rachel Favors. Thank you, Rachel.
It looks like Esther has a question. Esther, go. Esther, you can unmute yourself. You should be able to there.
Even if people are tested, there's nothing that says they can't go out in the community and be infected. So and from what I've heard, even if it does wane during the summer months, it can come back next fall. So what I've been looking into is if someone has been sick and then fully recovers and is tested, because from what I've heard, the virus can just remain dormant and then exacerbate. Hopefully, I'm trying to find out, because I'm a nurse, I'm trying to find out if immunity develops, can people then go and help other people without it having the possibility of infecting them? Right now we have no immunity within the country, because there haven't been a large group of people who have been sick and then recover. But I am looking for opportunities, should this happen, as to how to mobilize people who won't spread the disease, who are way or low risk, when they do go and help families who might be sick. And I think that's important to keep in mind as we move forward, that if you turn out to be immune because you have recovered, the obligation you can take on to go help other people, and to remember, even if it wanes during the summer, we're not in the clear.
That's correct. In fact, there have been a number of stories so far, people who tested negative and then a few weeks later tested positive, and they got over it, tested positive again after the recovery. So in fact, we don't even know right now if the COVID tests we have will pick up every strain, and if you've had it once, if you can get it a second time. We don't even know. That's a good point. But I would say, again, let's say we did have someone who wanted to help, personal protective gear, right? We could certainly gear them up. For example, in the N95 mask, we could gear them up in gloves. I mean, there are things we can do to lower the risk, not to reduce the risk, but to lower it. And again, especially those individuals are caregivers or caretakers who could help someone who desperately needs it. It might be that at that moment, the risk of a gloved and masked caretaker helping them out might outweigh the possibility of someone who's already had the virus passing it on. So again, these are medical questions that I'm not capable to answer, but I think it's a great point, right? We have to think about it as a community. Can we have a core, let's say, of individuals, those who are immune, or whatever title we give them, who could go out and help other people? That'd be a great organization to form. Yeah, so Rachel Fabers asked the question, why is this the first living pandemic in living history? How come flu isn't this scary each year? So this is a great question about species crossover. A number of the most terrifying epidemics and pandemics the last 20 years have come typically when human beings and animals have interacted in ways that we didn't see coming. Of course, most of you know that Ebola, named for the location in Africa from which it came, typically is thought to come from bats, actually. That was a bat-based disease that came over into the human population. A number of the H1N1, swine flu, a lot of these began in the animal population and then transferred into the human population. And again, typically we didn't have the immune system ready for those kind of responses. So that's a really good point. Again, I think typically flu has been passed around from us. Esther asks about requiring people to take public transportation. How do we get people in and out of places? I've heard doctors saying that if you normally take the bus, taking an Uber or bicycling or walking by yourself would certainly put you at less risk. And if you're asymptomatic and a carrier, but your colleagues at less risk, it's of course true, right? Every interaction that we have is a chance to spread the virus. If you're taking the bus, if you're taking the subway, if you're on those, if you have it, you could spread it to someone else and vice versa. So it could be that either staying home or walking or biking or some kind of private transport would be a way that would reduce the overall transmission risk. Maybe one last question so we can all get to sleep at a reasonable hour. Oh, so I see a question. The question was from Rabbi Berkesin. Is there any truth that this virus began in a lab in Wuhan? No, not to our knowledge. There is no truth that this was any kind of deliberate weapon or something that was started there as a biological contaminant deliberately. No, there's no evidence to that. Unfortunately, it's much more mundane. It's much more likely that, unfortunately, there is what's called a wet market in Wuhan. A wet market means that if you know the old school markets where they sell dried goods, wet markets also sell often live animals. And as I mentioned before, we believe that this virus, just like H1N1, just like some of the previous flus that we've had, like the Ebola virus, probably was a cross-species contamination. We don't know exactly what species it came from, but it definitely was not any form of deliberate attempt from China to do anything to anyone else. Their own citizens have suffered tremendously, and trust me, I've got friends in China who've been locked in their rooms, literally welded inside areas, and this is the last thing that they would want in anyone.
Okay, thank you so much. We are going, so we've recorded this lecture, and it will be accessible tomorrow online. If you know of someone who wants it, they can email me at director@mayan.org, or I also posted a link to our Facebook page where this recording will also be located. Just Mayan is going to be offering other classes, regularly scheduled classes, and we might be offering some other classes and lectures over the coming weeks to keep you all entertained. So keep an eye out for emails from Mayan. You can email me again at director@mayan.org if you want to be put on our mailing list, or like our Facebook page, and you'll see what we're doing up there. Thank you so much, and wishing everyone well and to stay healthy, and keep looking after each other, and call someone tomorrow.
Thanks so much, everybody. Have a good night.